And all of a sudden in Canada, the sun comes out and we basically have 3 or 4 months where it's beautiful weather and we all kind of jump outside and throw all of the work that we've done for the last 9 months into the garbage. And then we have to restart again in the fall, which is not necessary if you're really managing it.
I've actually struggled, I think, my whole life with like trying to find treatments to treat melasma because like I've always wanted to do IPL, but like we've mentioned before, IPL is heat. And I would never, like, I'm just too scared.
When you have melasma, it's less dandruff, and dandruff means defined borders. When you have pigment, it's a spot, and it's very clearly defined.
This is Skin Talks, the podcast where we go deeper than skin, products, and trends and explore the conversations that actually matter in health, beauty, wellness, and confidence.
We're a mother-daughter duo and the founders of Boutique Skin Envie. After years inside the industry, we've learned that health is never just about what you use. It's about everything you digest, how you think, how you live, what you eat, how you move, what you put on your skin, and how you feel in your own body.
If you're looking for insight, honesty, and a fresh perspective on the future of health, beauty, and wellness, you're in the right place.
Let's get into it.
Skin Talks podcast by Boutique Skin Envie, hosted by Beata and Natasha.
Welcome back to Skin Talks. Today's solo episode, Beata and I are going to be talking everything pigment. This is a very passionate subject that we like to talk about because I suffer from melasma, which is a form of pigmentation. And I know that you have pigmentation as well that you've been working on probably your whole life.
Yeah, it's been probably that I've been working on pigment. I've been working on pigment probably for 25, 30 years.
Yeah, and I would say for me, it must be approaching 6, 7 years is really when my melasma started showing.
Yeah.
Yeah.
Well, we're going to demystify everything about pigment today, but not from a like science perspective in terms of like we're not dermatologists or estheticians, but it's just based on experience, what we understand, our combined experience in the industry, personal experiences, and people that we've treated along the way.
Yeah.
So basically an episode about pigment, everything about pigment, our focus on brands that we like that target pigment on more profound level, like i.e. melasma, or just more softer for more sensitive skins. Yeah. The different kinds of in-clinic treatments that you can do that are really game changers, those to be cautious about, and the habits that quietly reverse the progress. Because one thing you have to know about hyperpigmentation, pigment, melasma, sun damage, age, spots, all of these things that it's referred to, is that it's a very emotional skin condition.
Yeah. Along with like other conditions like acne, for example.
Pigment is something that is hard to tackle because it is hard to get rid of. Even when you get rid of it, you still can't abandon your pigment routine.
No.
You always have to manage it. And basically it's a lifelong battle. And that's not to make you feel like you can't improve it. And, for example, my skin, I have a lot of pigment, but I don't have it because I manage it every day. So it's not something to look at like, oh my God, I've got pigment, I'm doomed. It's definitely correctable. It's definitely manageable, but you have to do it for the rest of your life. Yeah. I hate to break it to you. Even if you do IPL treatments, even if you get rid of it through hydroquinone or whatever, it's always temporary because there's triggers.
Yeah. So you have pigmentation, like you have sunspots.
From UV and sunburns and browning.
Whereas I have melasma, which I know for a fact comes from heat.
And also it's a hormonal issue, and it's much deeper in the skin.
Yes. But for example, like I was just recently pregnant, if you didn't know that. But last summer when I was pregnant, I had the best summer where my melasma was so good. Like you barely
under
saw
control.
It. Under control. I was pregnant though. So like people think that, you get like a melasma mask, what's it called?
They call it pregnancy mask.
Yeah, pregnancy mask where your melasma can really come through during pregnancy. Mine actually was like the best it ever was because I was using proper products throughout my pregnancy. My face was never ever in the sun. Like I always wore a hat, de la Harte. They have that sun visor.
Oh, that's an amazing visor.
Yeah, I've been wearing that I wore that all summer long. So my pigment was amazing. That being said, now I'm 4.5 months postpartum and summer's approaching.
And also your hormone levels are readjusting.
Yes, but I went for a run.
Oh, so the heat.
I went for a run and my face was red from the heat, and it wasn't even a cold day. I was wearing a hat during my run. Like, I do all the proper things, but I was so red and my body was so hot from exerting myself after being pregnant and having a baby that my melasma started to come through. And I even have noticed, like, on my
cheeks?
forehead is really where my melasma is. Like, that's where like the deepness is. But then I started getting a little bit freckly underneath my cheeks, like under my eyes and like cheeks. I have a little bit of freckles.
And also, do you get it on your upper lip? Because that's usually the target area.
I used to have it, and I used to have very big melasma marks underneath my eyes, like a sort of a raccoon. But that I've gotten.
You managed it through microneedling.
Now I have like freckles that have surfaced, which I know. So that's the whole point of this, is like, I had a really good control over my melasma last year. Granted, I was pregnant, but now all of a sudden it's a mess again. So I'm like, I know what I have to do to get where I want to be, and summer's approaching and it's getting hotter. So like, I know the steps I need to take. I'm obviously cautious because I'm breastfeeding. So like, doing the hydroquinone and all that stuff, I'm not going to be
not an
on.
option
It's just
right
a different,
now.
it's like the same process I went through when I was pregnant. You just got to be cautious what you're putting on your face. But like I said, or like we're saying, it's a lifelong battle.
It's a journey.
It's
like
a journal.
A journey.
It's a journey. So now I'm going into another summer where I've like, okay, I have to step it up. I know what I have to do. And it's like, it's always you're going to have ebbs and flows of it, regardless of your skin concern. But yeah, especially melasma.
Yeah.
It's not something.
Tough. So before we get into like the different types, specifically what I really want to highlight for today's episode is that we're going to feature 4 brands. One of them being an American brand, but 3 of them being Canadian brands. All have different approaches to targeting pigment and melasma. We're also going to talk about in-clinic treatments. We're going to talk about everyday habits. And we want this episode to feel like a strategy session, not like a scolding, not like we're giving you a kind of shit for do this, don't do this, don't do this. But we want you to approach it with like a strategy, like anything else in life. I want to lose weight, so therefore I'm going to do this, 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 and this. 3 months down the line, you reevaluate and you adjust, right? Yeah. So by the end of this episode, the goal is really to help you to understand what is going on with your skin.
Like just,
not to self-diagnose, but like you'll understand more about what your pigment issues are. And then the options in different types of skincare treatment approaches, but also clinic approaches, what to avoid, what to consider, and kind of like we walk you through it. And the reason why we're doing this episode right now is also because we're going into the summer season. And this is where, from let's say October, November through to March, April, everybody is like IPL, this and that and the other. And all of a sudden in Canada, the sun comes out and we basically have 3 or 4 months where it's beautiful weather and we all kind of jump outside and throw all of the work that we've done for the last 9 months into the garbage. And then we have to restart again in the fall, which is not necessary if you're really managing it. If you're dealing with melasma, your melasma, like you said, Tash, might come out a little bit more in the summertime. Things that you can do to help manage and mitigate. And so basically we're trying to give you a strategy how to keep your skin in check through the summer season so that you
our best
feel
recommendations
good.
Since we've also gone through it. Yeah.
Let's talk about at-home skincare tools because most of them are either too weak to matter or too harsh to be safe. If you want professional level results at home, you need something clinically tested and designed by skin experts. The Environ Cosmetic Roll CIT is a medical-grade derma roller that creates tiny microchannels in the skin so your serums can penetrate up to 80% deeper. It enhances results, it boosts collagen, and when used correctly, it's incredibly safe and effective. If you're going to invest in at-home skin technology, make it something proven. Use SkinTalks 15 at BSkinEnvie, spelled BSkinEnvie.ca for 15% off your first order. So let's talk about what pigment is. And we are, like we said before, we're not scientists, we're not doctors, we're not dermatologists, we're not estheticians even, but we've been in the industry for a long time. We treat a lot of cases through our virtual consultations on Boutique Skin Envie, but we also have a clinic where we treat a lot of patients that have melasma and pigment with our team of medical estheticians and also doctors. So we have a lot of expertise and a lot of years of expertise on really making it an easy approach to tackle. So let's talk about the basically, we have 3 main categories of pigment. The first one being melasma.
So this is, like I mentioned, was triggered by heat, could be hormones, birth control.
Mostly it's hormonally driven, mostly, and heat triggers it.
But heat could be a huge trigger for it.
It can be. Like if you ever seen chefs that are in the kitchen cooking all the time and there's always steam on their face from the ovens and from cooking.
Or even if you go in your car.
They will have melasma. And melasma is triggered by pregnancy, birth control, perimenopause. It can kind of show up at any point in your life. And it lives deep in the skin, right? So, and it's very stubborn. It's one of the most difficult types of pigments to treat and generally shows up in larger patches. So like if all of a sudden you look and your neck is like got this big, huge patch, that's a melasma patch. That's not pigment.
And it's like bordered. So like, it's like
very dandruff.
Yeah. So you can see like I like to say big. It's like an island.
Yeah. It's like big. It's not spots.
And if you're watching this on YouTube, or maybe we're going to cut this clip, but like my entire forehead is like in between my eyebrows. So like the top of my forehead is like a big patch of darker skin. I'm wearing makeup, so maybe you don't see it.
You don't see it as much, but I want to correct what I said before. It's when you have melasma, it's less dandruff, and dandruff means defined borders. When you have pigment, it's a spot, and it's very clearly defined.
Yeah,
you know,
and it's smaller,
like I have one right here that I'm always tackling, and it's more, and it's usually more surface level.
But isn't it also smaller, like little dots?
Yes, it is. But when you see a lot of little dots that are connected with like not so defined borders, but you can see like a shade, that's usually melasma.
I find it like, for me, it looks like an island.
It's like, and then when you have pigment, you'll have like a spot, another spot, another spot. And you can clearly differentiate one from the other. And that would be more considered sunspots. So if we just go back to melasma, it usually shows up in larger patches on the cheeks, like you said, nose here.
Also above the lips.
Above the lip, forehead. And sometimes I see it on the neck, or like the cheek area where it kind of shows up. Sunspots, on the other hand, or also known as age spots, are from years of UV damage. So that means UVA, which is responsible for aging, or UVB, which is responsible for burns and browns. It's, UVB is the sun. UVA is the UV rays in the, like in the air. It's kind of like you can't see them, but they're there. They're smaller, more defined, and they're generally easier to treat. Okay. And then you have PIH, known as post-inflammatory hyperpigmentation, which is basically scars. So the marks that are left over after acne or like an injury on the skin. Any kind of injury could be, sometimes when you have, like, let's say you have a procedure and you have a scar, it can leave a post-inflammatory pigment spot. It also can be after eczema, dermatitis. Like you have a scar that shows up as either a red patch or it can be brown.
Yeah. And why this matters is that basically every single one of them is differently.
And needs to be approached differently.
And it has to be approached differently and treated differently.
Yeah. So if you're not sure what you have, don't guess it. Go to see an esthetician, go to see your dermatologist and find out, do I have melasma or do I have sun damage?
We spoke to somebody from Zeo Skin Health at one point.
We did a podcast
We did an episode with them, and they gave a trick that if you stretch your skin and if it's pigment, it will stretch. No, there was a certain, it's not stretching.
It will change shape with the stretch, but if it's melasma, it doesn't, right? So if you're not sure, you could do that. But anyways, what we're going back to is don't try and self-diagnose. It's one of the worst things that you can do when it comes to your skin.
Yeah, it could, like one of the known things is that, like we mentioned, heat can trigger pigment, like melasma. If you have melasma, you don't want to do anything that has a lot of heat. And that's like, i.e. lasers. No, you don't. So like, don't diagnose yourself as like, maybe I have pigment, but you actually have melasma, and then go do laser and then like you could have worse outcomes, like consequences of that.
And if you, and also
just be careful.
be careful.
Talk to a professional. Like,
And even with the
research.
professional, ask them, even if you're with a professional, ask them to explain to you the difference between melasma and pigment. If they say, oh, you have melasma, but say, what's the difference between melasma and sun damage? Like, really be curious and dig into it, because sometimes people misdiagnose it and they treat it with heat, and then you end up with hypopigmentation, which is the reverse. You get white spots, or your melanocytes kind of like go crazy and your dark spots become really, really dark, which is very, very hard to treat. Yeah. So you have to make sure you're in with somebody who really understands it and knows what they're doing.
Yeah, be very careful.
So let's get into
the products that we recommend.
Yeah, we talked about earlier in the episode that we were going to talk about one American brand being Obagi. And then we wanted to talk about 3 other Canadian brands, and they're all manufactured in Quebec, which is fun. So let's talk about Obagi. So Obagi is the OG Dr. Zen Obagi, who created Obagi first, sold his company, and then started Zeox Skin Health.
Yeah.
So he's like the guru for me, or the OG of dealing with very, very specific skin concerns. One of them being an expert in hyperpigmentation and sun damage, melasma, everything under that category. And he developed 2 different systems in the Obagi brand. And one of them is called the NuDerm system. And the other one is called the Obagi C. In the United States, it's under RX, but here it's under FX system. So
the first one, the NuDerm system is basically a non-hydroquinone arbutin-based product line. So hydroquinone.
There's like 7 or 8 different SKUs in the brand.
But for people who don't know, hydroquinone is an ingredient that really helps with pigment. It's like
almost like a bleach.
Yeah.
You have to be very careful.
Yes. Don't just put it on your face. Just
so this is a non-hydroquinone, the NuDerm.
Yeah. Which a lot of people do recommend, which is why I guess it's arbutin is like a good alternative.
Well, arbutin is excellent for pigment. Yeah. It's a tyrosine inhibitor. I don't know if I'm pronouncing that right. So it prevents the melanocyte from like overactiveness, if that's even a word. So let's get back to it. So over 30 years experience, Dr. Obagi has this line, NuDerm non-hydroquinone based arbutin product. And there's 7 or 8 different SKUs. And this system is really designed to target stubborn pigment. So melasma.
Yeah.
Or like really deep pigment.
Yeah.
And the other one is the Obagi C FX system, which is basically a vitamin C combined with arbutin. So it's for more milder correction. So when you look at your skin and you're trying to decide which system to go on, is it something that you've had for a long time that you can't treat, or are you just starting to develop pigment? Because pigment, what people also don't understand is like your skin ages, right? As you get older, your skin ages. And what most people will say is like they're developing fine lines and wrinkles, or they'll start to see like lack of tone and laxity in their skin. But another telltale sign of age is pigment. Mm-hmm. So there's basically 3 pigment categories. There's 3 aging categories.
Fine lines and wrinkles.
Fine lines and wrinkles, lack of tone and density in the skin. So lack of firmness, and pigment. So usually when you've got more pronounced pigment, you're going to go more to the NuDerm system. Yeah. When you're just starting to see like maybe a little bit of spots, or you have post-inflammatory hyperpigmentation after an acne breakout, getting into the Obagi C FX system would be a good alternative, or a good solution, I should say. But the most important thing, whatever you do when you get into the Obagi system, because that is a system, is that you really have to follow the system. And the skin cycle is 28 to 32 days, depending on how old you are and how your metabolism and your system works. But you can't cherry pick when you're dealing with pigment.
No,
you've got to get on the system, and you've got to commit to it.
Yeah.
Don't abandon it, and don't abandon it in the summertime, especially.
No. It's very important that you stay committed. And
the other thing is you really need to trust the process, and also know that sometimes when you have pigment, and this has happened to me often with people that we treat virtually or in the clinic, they come back after the first month and they're like, oh my God, my pigment's darker. And I'm like, good. They're panicking. Yeah. But I'm like celebrating, because that means the pigment's coming out, which is what you want.
It's like even when you get a skin treatment and then like your skin purges.
Like IPL.
I've done Yes, like IPL. But we're going to get into the treatments after, but I've done treatments where like my pigment literally was like on the surface of my skin. It was like craziest.
Like you can almost feel like you
Like,
could scratch it off.
yeah, it's almost,
right?
it almost looks like I have tiny little scabs everywhere.
That's what
so
you
I would
want. It's
scratch
like
it off and
heaven.
I'm like, oh my God, my pigment's not
It's
there
heaven.
anymore. It's the best thing.
It's
I'm like dying
heaven.
to get another one. But yeah, so Obashi, great. I trust this brand a lot. I just think that he's an amazing.
Yeah, he's a formulator. He's amazing.
yeah.
He's also a doctor, right?
Yeah.
Like this is what he does every single day. And he has a very strong methodology and
not mess
system.
around.
He doesn't mess around. And so you have to just trust the process. Yeah. No different than when you're getting into, you have acne, for example. You have to trust the process. You have to give it the time, and you have to know that sometimes it gets a whole lot worse before it gets better. And that's what you want, because it means your skin's working and you're purging, you're getting rid of it. You're pulling it to the surface and then you're sloughing it off. So so just to complete that, you need to be ready to commit when you want to target your pigment, period.
Yeah, with any brand that you choose. So doesn't matter. Like you have to be committed.
You have to be committed. Yeah. So let's get into the next one.
Is Laboratoire Dr. Renault. This is a #1 dermatologist recommended brand in Canada. It's made in Quebec, which is amazing. It's science-backed and it's really, really a great, gentle brand as well.
It's very popular. I went to, a matter of fact, I went recently to their manufacturing facility in just north of
Laval.
Yeah, just north of Montreal. And wow, very, very impressive, very, very serious company. The approach that they have to pigment is very dermocosmetic. They have a brightening line that works on uneven tone, post-acne marks, and early pigment, but really without being aggressive.
Yeah, which is also nice for some people. Some people really don't want to like wake up and do a routine and have like that potential irritation or that redness or like that uncomfortableness that like some other people are okay with. So it is like, not that saying that this brand doesn't work. This brand works just as well. It's just that if you're somebody who doesn't want to be so aggressive on their skin, it's a great alternative.
Yeah, it is. And it's, for people who have, let's say they've tried to use hydroquinone or they've tried using other brands that have harsher pigment ingredients in them, this is kind of like where your sweet spot is. It's going to tackle the pigment, but it's not going to irritate your skin. So really, really good for people with sensitive skin that have pigment, because it exists, right? We have all different types of skin types with different concerns. And it's also great for people that have post-acne, so post-inflammatory hyperpigmentation, that have deeper skin tones, and the client, definitely a client who just wants to support a Canadian made product. I mean, that's definitely, we get a lot of that. We have a lot of requests for that. The next brand that we want to talk about is ProDerm, which is another little gem of a product line also made in Quebec. It's pharmaceutical grade. It has such beautiful and elegant textures. It's not a big brand. And their whole philosophy, from what I understand, is supporting your skin while you're going through pigment treatments.
Yeah, like post-procedure.
You can use it every day. It's definitely got a whole range for everyday use. But when we're talking about specifically pigment, when you're going in and you're having treatments done, sometimes these treatments, whether it be IPL or microneedling with RF, deep peels, your skin barrier gets a little bit wacky. So like a product like their regenerating cream is essential after peels or retinol use or laser treatments, because it really calms, hydrates, and it builds the barriers so your ingredients can keep doing their job. And you're supported by a product that is going to really target the homeostasis and your skin barrier. So there are a lot of treatments where pigment is treated aggressively, right? When you're thinking about laser treatments and stuff like that. So ProDerm is really the brand that's going to keep the barrier healthy throughout this process. And it's kind of like, when you're tackling things, we have a mentality often in our culture that we want everything yesterday, So we go in with full blazing, like running to the finish line, but it's not, what do they say? It's not a sprint, it's a marathon.
Yeah. Well,
We really mess those, or I mess them up a lot, but it's really about the long game. So yeah, so ProDerm, anybody who's doing, when it comes to acne, anybody who's doing serious pigment work needs to support their skin barrier. And this is a great option.
Yeah, you're going to also see just results a lot faster too. I think when you're supporting your skin through invasive treatments, it's very important. It's not like
promoting inflammation, which is also going to cause pigment down the road.
Yeah, exactly. The fourth brand, which we also love, is Aquafolia, another Quebec-made professional-grade brand.
Yeah, another Quebec gem.
Yeah.
And very popular.
Very popular.
For us anyways. Like, we do very well with this brand. People absolutely love it.
Yeah, they have products for brightening an uneven tone. Their formulations are really designed to work with the climate of Quebec. So like the ups and downs, the colds, the warms, like we get it all, right? So they have that in mind when they're formulating their products, which is also very beautiful. They also use, I would say, a little bit more of like a gentle formulation. It's not super aggressive, which is also very nice.
It's not like your skin's going to be peeling or...
Yeah, exactly.
They have a very progressive, gentle approach to getting the results, but not where they're going to irritate your skin. I've never had anybody come to me and say, when I'm treating pigment with Aquafolia, have I ever had anybody come and say, I can't take it, my skin can't take it?
No. And I think that this brand is really good for people who want more of a natural approach.
Yeah.
They're very I wouldn't want to say natural. Well, like what does natural mean in terms of like a natural brand, but
it's not complicated and aggressive.
Yeah.
It's
just very gentle and like,
but gets you where you need to go, but with
there's some serious gold standards in that brand too. Like
oh my God.
People love.
Loyal. People that buy Aquafolia come back and buy it again.
The mask I know is like a huge hit. The cleanser.
But also the 2-step exfoliating system.
Triple something.
1 and 2. It's crazy. They're cleansers. They also have an amazing vitamin C serum that's excellent as a daily antioxidant protection against pigment forming. Like, don't forget, vitamin C is also supporting prevention of pigment and treatment of pigment. Like, it is very, very good. Reduces inflammation in the skin. Everybody should be on a vitamin C. Yeah. So Aquafolia is the kind of brand that we recommend for clients who want a more neutral approach to pigment correction without sacrificing effectiveness. You know? Yeah.
And also made in Quebec. So if your listeners, you want Quebec brand, this is also a Quebec brand. I think also they're made in, if I'm not mistaken, in Laval also. Yep. Could be wrong, but yes, really great brand. Love it.
Yeah. We people, huge following.
Yeah. Now moving into in-clinic treatments. We've spoken this a little bit before. There's a lot that you can do in treatment that's going to help with your pigmentation. I've actually struggled, I think, my whole life with like trying to find treatments to treat melasma because like I've always wanted to do IPL, like we've mentioned before, IPL is heat and I would never, like, I'm just too scared. I'm sure it's possible. You never know, but I'm a little bit, I'm weary.
Schools of thoughts. There's some schools of thoughts that believe like people that are behind IPL or let's say, what's the other, treatment? It's called BBL. People are behind those companies will say treat with hydroquinone for 3 to 4 months, then teeter off and go into a brightening system and then incorporate light IPL into that. I'm just
scared personally.
Yeah, I'm not a huge fan. Yeah. Because I worry about that. I worry about anything to do with heat. There are some treatments like Clear and Brilliant, which you've done before, which is amazing. Loved. Because I don't know if it's heat or it's just the way the heat breaks the light. It's light. It's hitting the water in your skin. And then,
yes, exactly. It's hitting the water in my skin. Like I did it. You're supposed to do one treatment a month for 3 months. Yeah. And I did just one treatment because it was like a trial thing. Love the results. I'm like dying to do it again.
I remember when you had that.
I thought I was my peeling the pigment off of my, like I need to book
it really pulls it up to the surface.
That being said, I've also another, treatment that I've done, 2 other treatments that I've done for melasma a lot in my life is microneedling. Yeah. I'm a big microneedling fan. I think that this treatment is incredible.
Because it really breaks up deep pigment.
But it's not even just for the pigment itself. It's a treatment that's also going to work on like literally everything else. The texture of my skin's going to be amazing. My pores,
redness,
everything,
fine lines.
It's such a beautiful treatment.
It's
and also peels.
Huge.
Peels for me have been very, very. I remember for a time, I was doing peel and microneedling like a combo. So every 2 weeks, I was doing like 1 week. Starting 1 week, I did microneedling. 2 weeks later, peel. 2 weeks later, microneedling. 2 weeks later, I was doing that. I was like seriously on it. My results were amazing.
Yeah. No, I remember when you were doing it. So I think the way I see pigment, whether it be on melasma, post-inflammatory hyperpigmentation, or sun damage, like the spots from UV, it's not a one size fits all.
No.
It's always a customizable plan. And you really have to be intuitive as an esthetician, or even if you are doing home care treatment, like if you're using product at home, is you always have to check in and evaluate, because you're always having to tackle things from different angles. It's really a 360-degree approach. So for me, if I'm tackling pigment, no matter what, the first thing I'm going to do is a very good facial. So basically setting the canvas up for whatever you do afterwards to have a better effect, because your skin is super hyper clean, hydrated, and ready to receive, right? So you may come in afterwards and be able to do IPL. You may come in afterwards and do a peel. You may come and do microneedling or microneedling with RF, which is, for example, Morpheus 8. You could do LED therapy. You could do a whole bunch of things, but you always have to check in. Where are you at in your pigment, your rejuvenation and that resurfacing component, to decide what is the next best treatment to do? Like, where's your pigment at in its correction phase? And you can have a perfect plan for that with your esthetician and even your home care, but it could change depending what happens. So you always have to go in and say, okay, like now you're here, I think we should do a peel to really resurface everything, shut it off, and then right afterwards do an IPL 2 weeks later or 3 weeks later.
Yeah.
So never just follow a plan without checking in to make sure if it's relevant for you, because everybody is different.
Yeah.
And
how your skin
every
reacts to
pigment is
treatments.
different. Like some people have age spots and all you have to do is 3 treatments of IPL and you're good.
Yeah.
Right? It's gone. Where other people, you need to do 3 treatments of IPL, then you need to do a couple sessions of microneedling with a peel, and then you have to start back afterwards and do like maybe 1 or 2 more sessions of IPL, because you have to pull it out and get rid of it. And never forget that if you're doing all of these, if you're investing in all of these things in clinic, you definitely need to have a home care program that supports that, because otherwise it's like going to the gym and eating McDonald's. If you don't have a proper system at home that's going to support the results that you get in clinic, it's 80% is at home and 20% is in the clinic. So the clinic is really going to accelerate and push, and at home you're going to repair, maintain, and progress with your skin. But you can't do one without the other. Or I just don't recommend it. I mean, anybody can do what they want, but it's not
a recommendation.
It's not the best protocol for tackling pigment, in my opinion, or my experience and what I've seen. So let's talk about SPF, sunscreen.
Sunscreen is like a no-brainer. We talk about it any chance that we can get, that you need to apply SPF. Like it's not even understand why we're not doing it yet.
Yeah. So especially with pigment prone skin, SPF is a non-negotiable.
Yeah.
I mean, it's for everybody, but definitely a non-negotiable. And there are application of SPF in the morning, before you even leave the house, even if you don't leave the house, and even if it's cloudy and rainy outside, and then reapplication during the day. If you're targeting pigment with hydroquinone, not hydroquinone, retinol, peels, lasers, all these different things, and you're not using SPF, you could even eventually, I would dare to say, cause your skin such a disruption that your pigment would no longer be treatable, or you're going to have a really, really hard time with your pigment because you're not supporting it by protecting it. So it's really part of the recipe and the formula to use an SPF. So great SPFs while you're going through these types of treatments and stuff is a tinted mineral SPF. We love those. We love mineral, especially for pigment, because chemical sunscreens, they convert
To heat.
the UV rays into heat, which triggers pigment. So maybe, I'm not a scientist, but it's been said that could be a trigger. So I steer clear of that. Mineral sunscreens work like a mirror. So they bounce off the rays.
Yeah.
They don't absorb into the body. They sit on the surface. And so I always recommend a SPF. And when you use one that's tinted, it will really help, like you said, for your melasma. It helps to camouflage it. It helps to blend it out really
That's what
nice.
I'm wearing now. Every day I wear it. It's a Color Science Flex.
And there's in the Color Science Flex, they have very, 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 very fair to very, 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 very dark. So if you're ranging from 1 to 6 Fitzpatrick, there is an SPF for you. And what's lovely about this range is that you can mix two together to get the right color for your skin. You just have to experiment.
Which I used to do, but now they just launched 2 new shades. They launched a very deep or rich deep.
The ultra deep, I think it's called.
And then they did light, which is in between fair and medium. But it's still, regardless, like if you're in the middle a little bit, you can definitely mix and match, which I love to do. Another one that's really been super popular for us is the Tizo.
Yeah.
And the Hydro Tint from Melasma is also another.
It's an excellent. Vivier has an excellent tinted SPF that you love.
Like SPFs have just evolved so much, and they're so beautifully formulated that, I mean, if you wanna, it's summertime and you don't want to wear foundation, but you want to have an even tone, like they're glowing. Yeah, they're glowing. These are the products that you should be applying at the end of your routine for, one, the protection, 2, prevention, but also to have a nice even complexion. Like don't wear the foundation in the middle of the summer.
Yeah.
Have a breathable, proper mineral product that's going to be good for your skin.
And one other thing that I really like is Proderm has it. I think Dr. Renault has it.
And
Da Vinci has it. Color Science has it. There's many different brands that have this, but it's basically a powder SPF.
Yeah.
So cool. if you're on the road, out on a patio, golfing, and you can't reapply a cream, or you forget your cream, have one in your purse and you just apply it. And they're all SPF 50s, and they will lightly dust a sunscreen powder onto your face, and it works absolutely beautifully.
And then also look at Kula, which is an innovative brand. They have sprays, like a nice refreshing mist that has SPF in it too. Don't rely on these products as your sole SPF. Like always put one on first in the morning and then use these to reapply. Yeah. But it's
especially if you're out golfing or sporting in the summertime.
Kula is very innovative and has like really cool scents, and like they're
very
cool.
popular. It's popping off right now. It's colorful. They have like different scents like mango and pina colada. It's really fun. So let's talk about the habits that sabotage your pigment work.
First one is hot showers and steam right on your face. I am definitely guilty of hot showers. I like when I come out of the shower, my skin is pink. So maybe I should stop doing that.
Don't do it.
Interesting.
Yeah. Heat triggers some ear melanocytes.
Yeah, but I love a hot shower. It burns off.
You might want to do it on your body, but on your face, don't put the hot water on your face.
Yeah. Obviously, I should be knowing that.
Lukewarm water, or like more on the cooler side at the end of the shower. Another thing that can sabotage your pigment work is skipping a morning antioxidant. Like a vitamin C is something that I think everybody should be on. Especially when you're not doing like a deep treatment with, let's say, hydroquinone and stuff, you can go into more the maintenance program, which always is going to contain a vitamin C, in my opinion. And there's a vitamin C for every skin type. So if you're acne prone and you have pigment, don't worry. There's a lot of vitamin C's out there, like Silymarin from SkinCeuticals, that is specifically for acne prone skin.
Yes. The next is reapplying SPF only when you remember.
Yeah, you should set a timer on your phone.
Yeah.
Every 2 hours, rain or shine, just do it. The hats, if you don't wear a hat when you're outside, if you're walking on the beach, walking on the street, going running, golfing, sitting on a patio, wear your hat.
They make really cute hats nowadays, so just wear one.
Yeah, and the ones from De La Harte are really cool.
I love mine.
They're fun. And they have them in new colors, by the way. They have some new colors. I think indigo and like brown or something, dark, deep brown. Yeah.
The next is driving without SPF just because you're in a car. UVA goes through your window. I also want to note, if you want to be extra cool, like driving gloves. Yeah. To sort of avoid spots on your hands because your hands are always on the steering wheel. So that's something you can
and I'm somebody who has pigment on my hands, so I'll tell you from experience.
Yeah. So that's something, another habit.
Don't pick at your melasma or try and rub it off. That's like definitely a no-no.
Yeah.
You can't exfoliate pigment off your skin.
Yeah. And if you're going to like exfoliate to an extreme, like you can be causing more inflammation, which can cause more melasma.
And pigment, yeah.
Yeah. Trying every new product you see on Instagram from your favorite influencer. Just because somebody is using a specific product for their skin type does not mean it's going to work for you. We
There's no
preach this
miracle.
all the time.
There's no miracle.
Yeah, no.
Systems and commitments.
Yeah, exactly. Speak to professionals.
So things to do: wear sunscreen every single day, every morning, rain or shine. We've said it a few times, but we're reiterating it now.
And reapply it every 2 hours.
Absolutely, 100%.
Stay on a full system. Like do a system from a brand that's made to work together.
Not cherry picking.
Yeah.
Keep your monthly facial or treatment throughout the summer months. Like, do not abandon your skin treatments in the summertime. There's, people in Canada think, oh no, we're going to stop all of our treatments in the summertime. The only one that you can't do is IPL because you can't do it on tan skin or dark skin tones. It can actually burn you. That's the only one that you stay away from. But everything else you can do because people live in the South. There's Florida, California, where it's summer all year round pretty much. So you can treat your skin in the summertime and don't abandon it.
Wear the hat, wear the sunglasses, and sit in shade.
And drink a lot of water like it's part of your routine. Don't do IPL. We just said that. Aggressive peels where you're removing layers of your skin in active summer months, especially if you're an outside person. Save those kinds of treatments for October.
Don't fall for at-home laser devices marketed for pigment. Like, just don't do
it. You stick with the ones in the clinics. They're tested. They're Health Canada approved. Like, you want to make sure that you're using products that know what they're doing.
Yeah.
Lasers that know what they're doing when you're treating pigment. Don't expect 6-week miracles on pigment that took years and years to develop.
And don't just stop because the results aren't going, like they're slow, and don't stop because your skin is purging. Keep on going. It's a marathon.
It is a marathon. So it's not a sprint, it's a marathon. Like what I said before,
Figured it out.
Trust the time that it takes to get rid of it. And you, with the right routine, with the right advice, you can definitely minimize it and you can definitely get rid of it to a certain extent. So to close, there's a couple messages that are really important for us when we're talking about, like be hopeful because pigment is treatable when you have a plan.
We talk about this all the time. Pick a brand and follow the entire system. Don't cherry pick different brands. We are preaching this all the time.
And add in clinic treatments. Don't just only do, if you can afford it, do the clinic treatments too, because they'll amplify the work.
Stay committed throughout the summer. Don't just stop and then restart because you're losing time and you're just restarting.
You're just going to have to start all over again.
Don't do it.
The people who stay on track between the months of April, May, September, October are the ones who walk into fall glowing. The ones who pause are the ones that have to start over, basically, which is what we just said. And book a virtual consultation with Boutique Skin Envie. We have it available on our website. We have a team of estheticians. We will talk to you about your skin in person over Zoom so that we can, I say in person over Zoom, but it's a virtual consultation where we actually look at your skin. We look at the products that you're using and we talk to you for 20 to 30 minutes to really understand what's going on with you. And then we build a program. Actually, we build 2 programs, an option A and an option B, which is personalized to what you need. And it's really going to help you target the pigment in the most rewarding way and help you with your journey in correction.
We just popped off on it, but we really hope that this episode helps you guys.
Yeah.
Brings a little bit more knowledge.
And also hope
around the subject. That we all go through something. And as long as you are speaking with professionals, you're doing your own research, you're understanding your skin, you're trusting your esthetician that you're seeing.
And the process and the time.
Exactly. Like you're going to be
You'll
good.
get there.
Yeah.
You'll get there.
Thank you for listening. We'll see you next Wednesday.
Thank you so much.
Thank you for listening to Skin Talks.
If this episode inspired you, taught you something new, or just made you feel seen, please share with someone you love. And if you believe in thoughtful and empowering conversations that help you make better choices for yourself around your beauty and wellness, please rate and review the show. It helps us to grow our community and we deeply appreciate it. Because this isn't just about skin.
It's about claiming your beauty, feeling strong, informed, and at home in yourself.
See you next week.